Preferred provider organizations, or PPOs, are the most popular type of private insurance in the U.S. PPOs are a type of managed care organization. They create their own network of providers for the policyholders to choose from. PPOs are popular because they give the policyholders the flexibility of choosing their physicians and also reducing costs for medical services. The providers that are contracted with the PPO are in an agreement to accept reduced fees. They do this because the PPO guarantees them a large pool of patients that will potentially choose to use their services. In a PPO, if patients do decide to seek services outside of the network that was set up, the health plan will pay a lower amount of reimbursement, thus forcing the patient to pay a higher portion of the costs.
A PPO, or Preferred Provider Organization, is a plan where no primary care physician is required. This makes it easier to access specialists. A PPO network is larger than an HMO network, allowing access to statewide, sometimes national provider networks. A PPO allows you to go out of the established networks to receive benefits, although it will cover less of that cost of care. So the PPO is a less managed healthcare plan. EPO stands for Exclusive Provider Organization. No primary care physician is required, making it easier to access specialists. An EPO also allows access to statewide, sometimes national provider networks, but an EPO plan does not cover out-of-network care. So an EPO plan gives you more control of available health care and doesn't require that you have a primary care physician. And we should also mention that with each of these three plans, co-pays, co-insurance, the deductible, and out-of-pocket maximums can vary. And when it comes to true emergency care services, all of these plans will provide payment to any emergency provider. Now you have a better understanding of the three policy types. An HMO is a more restricted and managed care. It may be more difficult to get authorizations for tests and procedures. A PPO is a less managed care, and it may be ideal for those needing more provider options and those who want more control of available health care. And an EPO is a broader, less managed care. It may be ideal for those wanting lower premiums and no primary care physician. This is just one of a few different parts of health insurance you need to think about when choosing the right plan.
Here is a pretty simple breakdown of the differences between the two different major types of managed care organizations. As you can see, an HMO policyholder is restricted to their PCP and relies on the PCP to direct their care to specialists, all of whom are in-network. For a PPO, the policyholder has the freedom to choose a PCP or specialist who is either in or out of network, but will pay a higher amount if they choose to go out of network. In a PPO model, a referral is not required to see a specialist.